Some of the drugs that cancer patients take or have taken obviously have an effect on things like taste. How can we compensate for that?
Yeah, taste changes is something that's really common, and there's quite a big range of different taste changes, or the change that people experience can be quite varied, from no taste at all to metallic taste to not being able to have certain flavours, or hot and cold. So there's quite a few different things that we can recommend. So firstly is just double checking your mouth, so making sure there isn't any infection there like oral thrush or any ulcers that could be making things more difficult. Really focusing in on your oral hygiene and healthcare. It sounds something quite simple, but sometimes we do neglect it a little bit. Then in terms of eating, it's thinking what is it that's particularly difficult for you? So is it a metallic taste? In which case we do recommend perhaps trying to avoid metallic cutlery or saucepans, things that can make it taste a bit worse. No taste at all, adding extra flavours in, so herbs and spices can be helpful. Another thing is thinking about texture as well. So if the taste is a bit more difficult, try and enjoy your food using another avenue. So the texture, but also temperature. So is hot better for you or cold?
Okay, that's really useful. I've found that since I've had chemo, I can't have spicy food. It's a complete no-no. So you lose some of the actual taste with that, and it's trying to compensate for that, or actually being aware of that, so that when you're eating out, you can look at a menu and go, I'm not having that, that's going to blow my head off. Or but being able to cook something equivalent at home where you can adapt the recipe and do what works for you.
Absolutely, and I think what you've just summarised there is the individual nature of taste changes, and that there's not one size fits all approach that people can follow. So it's thinking kind of what does work best for you, and trying lots of different flavours and different foods. You might find that something you've never tried before is actually your new favourite thing. So it is always worth trying things just in case they might work. But it's also something that you can discuss with your team or as dietitian to try and work around that and find that slightly different way so you can still enjoy your food regardless.
Absolutely. And colour, I find as well, is one of those really good ones for being able to look at a plate and think, that's going to taste good because it looks good.
Absolutely. No, that's a really important point, and I think it's just getting that interest in whatever way works best for you.
How can diet affect the psychological effects of a cancer diagnosis? You know, on days when you're either anxious, you're depressed, or you're just generally not having a good day?
Often that people do use diet in that time, and that can be of varying levels of wanting to eat everything or finding that is more comforting to be eating, or actually totally put people off their food as well. And I think there also can be quite a lot of anxiety around what people should be eating whilst living with breast cancer, and the amount of information that there is available on the internet, some credible and some not, can make things more difficult as well. So in that instance, we'd always recommend thinking about where you're getting your information from.
I find that I suffer from fatigue quite a lot. Is there anything that I can add to my diet that would help?
Yes, it's a great question and something that's really commonly asked. What we can find is it's not necessarily specific foods, but thinking about your eating patterns across the day. So making sure you're having little and often and regular meals, that can certainly help. And trying to get that balance of meals can be helpful as well. Getting a good source of carbohydrate, because that helps with energy, can be a good way to get that little bit extra in. I think also being careful about not utilising all your energy in terms of cooking and then not really wanting to eat because you feel so tired. So it's thinking other ways like a bulk cook, or perhaps sometimes if you need to, relying more on kind of ready meals or more convenience foods if that is particularly difficult, or you know there's going to be some certain days that are going to be harder than others.
Okay, no, that's really useful, because some days you've got the energy to cook, and some days you just want to pick something out the fridge and go, I'll have that.
Absolutely, and that's where bulk cooking or keeping some extras in the freezer can be really good, because you can just pick them out, reheat them and eat them without as much effort and energy needed on those days.
Brilliant. So one of the side effects that I have from treatment and the drugs and menopause, because of being a hormone positive cancer, is that I've gained weight. What can I do to minimise that, and what choices can I make in order to try and prevent any more weight gain?
This is something we find is quite commonly happens, and it is really difficult because there are times, if we've mentioned fatigue, that it can be quite difficult, and there's changes that are outside of what you're able to do from treatment side effects or fatigue. But what we do recommend is when you are feeling able to make those changes, is thinking a bit more mindfully about your choices of food. So perhaps along kind of when thinking about snacks, is there ways that you could switch those to slightly healthier alternatives, like a handful of nuts and seeds, or perhaps some lower calorie snacks like popcorn rather than some alternatives. On the other hand, is thinking about what else can you do. So is there any way that you could incorporate a bit more movement or activity into your day? And that doesn't have to be going to the gym. That could be walking up and down a few stairs, or making more movement whilst you're cooking, just trying to minimize that time that you sat down. But I appreciate that's not always that easy. It can take time, and losing weight unfortunately can be really difficult. But what's also more important is to try and kind of stay happy, and also have that bit of flexibility that yes, this can happen, but it may not always be possible to prioritize that all the time, and it's finding what symptoms or what is most important to you. But there certainly can be some dietary changes, and I would recommend speaking with your team, or see if you can have a chat with the registered dietitian as part of your wider team, who'll be able to advise you individually on what could be the most appropriate and easiest options for you. If you have any questions or concerns about diet or breast cancer, or you're considering making major changes to your diet, then we would recommend contacting your GP or treatment team.
You can also contact us at Breast Cancer Now, and you can do that by contacting the nurses via the helpline or through our Ask Our Nurse service.